Good afternoon, everyone. Can everyone hear me? Yeah. All right. Well, we're going to talk a little bit about the basics of talking to your legislators. The most effective way to do so you can get your message across from why you came all across Texas to tell people in the pink dome why Texas Medicaid matters. The first thing you do when you walk into that office, you're just going to introduce yourself. You're going to do, this is the hook of the hook, line, and sinker approach. When you introduce yourself, you let them know why you're there. You let them know why you're there and who you are. This is your best opportunity to tell them that you are a constituent, that you vote for them, that you don't want to threaten the fact that you vote for them, but you want to let them know that you are in their district and you care about these issues. So that is the first part of the introduction. If you then ask, do you have a moment to speak with us? Do you have a health policy person in the office that would be knowledgeable about these matters if the lawmaker is not available? Secondly, you're going to try to build your case. When you build your case, that is the line of the hook, line, sinker approach. Building your case involves laying out the facts of what you're trying to attempt to get the message across about. That's when you tell them about your story. If you are a Medicaid participant, if you have a family member who's in Medicaid, if you think Medicaid benefits your community in certain ways, this is the point that you tell them why Medicaid is important to you. If you want to expand Medicaid, like we all do, this is the point where you would lay out Medicaid expansion is important for these reasons. It helps our economy, it gets people insured, it gets them the health coverage that they need. This is where you build your argument, and most of the conversation, especially if they ask questions, will exist in this portion of the ask, if you will. And the last portion of the hook, line, sinker approach, that sinker that really hooks them in, that really gets them, is the ask. And the ask is very important because a lot of people go and visit their legislators but don't actually ask them anything. The important part of getting in front of them or getting in front of their staff, which is just as important, is asking them to do something for you. In this case, we are asking two things: to protect Medicaid because we know how important it is to our communities, and to expand Medicaid because we have the highest uninsured rate in the country. Those two things are your asks. Mr. Lawmaker, Mr. Staff Person, Mrs. Staff Person, will you support the expansion of Medicaid? It is important to lay out that ask for them so that they know exactly why you're there and they can respond to you. When they respond, well, the representative is weighing all options. Okay, that's great. Well, can we follow up with you to get you some more information so that we can figure out where the representative's stance is in the future? It's important to make that ask. And that process can take as little as 15 minutes, and it could take up to 30 minutes or so. You have to kind of go with where the staffer is, if you ask any questions, if she is knowledgeable on the issue. But make sure you let the office know that you are there for a reason, that you are there to let your voice be heard because this is your elected government and your opportunity to tell them that Texas Medicaid matters.
Okay, great. So now what we're going to do is run through basically three different scenarios. Clayton and I thought we'd start with a scenario of walking into an office of a lawmaker that is actually supportive of Medicaid expansion, because several of you might be visiting lawmakers who have already come out and said they do in fact support protecting Medicaid and expanding Medicaid. So forgive Clayton and I, this is our very first acting experience.
We're going to get an Oscar for this, I'm pretty sure.
Okay.
Good morning.
Good morning, I'm Dimitry, Texas Care for Children. Do you or the representative have a minute to talk with me about Medicaid expansion?
Definitely, yeah, the representative's out, but I'd love to sit down with you. I do his health policy work.
Well, expanding Medicaid is really important to me, so I really wanted to get your thoughts on where the representative is, what he's feeling about Medicaid expansion.
Well, the representative is definitely very supportive of Medicaid, and especially Medicaid expansion. We realize how important it is. And honestly, since we're kind of already on your side, you should just go to some other offices because there's a lot of lawmakers in this building that could really use that message.
First of all, I want to thank you and the representative for your support of the Medicaid expansion. But, in our understanding, it's really going to take a really heavy lift to get this thing passed and to get Medicaid expanded in Texas. So I really wanted to ask you, you can communicate to the representative that we really want to thank him for his support, but actually ask him to also be a leader on this issue.
No, that's a great point, and I know that the representative really wants to take a public stance when it comes to Medicaid expansion and the Medicaid program in general, and I will pass your message along, especially since you are a constituent, and in your community we know that Medicaid is important.
Great, thank you. Okay, that's a supportive lawmaker. And the reason we wanted to communicate back to you guys is because, we have a lot of our supporters and great leadership that are behind this and behind us with Medicaid expansion, but we don't just want them to just support it. We need leadership here. So we do need them to continue to communicate with their colleagues, their fellow lawmakers. So we're not just asking them to support Medicaid expansion, we're asking them to be very vocal about it, to be a leader on the issue. So if you go into an office and they say, hey, we already support it, but you should go talk to other offices, take that as an opportunity to ask them for just a little bit more on the issue.
And again, this is you coming from all across the state of Texas to voice your opinion in your elected government. So you should take every opportunity to do so and not be discouraged for any reason. So I think we're going to jump into another scenario, our second out of third. And this is going to be what we like to call maybe an opposition staffer or a staffer who's not there yet, because everybody wants to expand Medicaid, they just might not realize it yet. And we're going to go ahead and set up the scenario as you're walking into one of these offices. Good morning.
Good morning. I'm Lauren Dimitry of Texans Care for Children. Do you or the representative have a moment to talk with me about the important issue of Medicaid expansion?
Oh, Medicaid, yeah. The representative is out, but I have a moment.
Okay, great. I've seen Medicaid in my community really benefit children, also benefit the elderly folks in my community. And I really want to ask that you communicate to the representative that we think the Medicaid expansion is an important, really critical thing for the state of Texas. And we'd like to see more coverage options for low-income Texans that currently don't really have affordable health care options.
Yeah, I'm glad you came in today. The representative really does care about health care for people. He does care about the Medicaid program and understands it's needed. But we really got to look at this Medicaid program. I mean, it's been in a growing portion of our state budget for a long time now. It's crowding out other areas, and I don't know if that's more government spending that we need.
I think recently what we've seen is that there's a lot of conservative leaders across the country and other states that have gone ahead and decided to expand Medicaid because it does actually make a lot of financial and economic sense for the state. And on top of that, there are opportunities this session with our own budget to make some wise investments. It's my understanding that we have some money to work with this session.
That's right, we do. And how much exactly revenue are we looking at right now?
I don't have those exact numbers with me, but I do have some materials to leave behind, and I'd love to get back with you with those exact numbers.
Yeah, I think I'd really appreciate that. One of the other things, I've heard about Medicaid, and especially a lot of our delegation, is that I'm not sure if we want to expand Medicaid because it's going to be crowding out some other important things like education. We have a lot of education funding to do this session, and you care about education, right?
I'm glad you brought up education because actually we are very supportive of public education, and from our perspective, really, a family needs both education and health care. So it's really not either or. We'd like to see both a strong public school system and a strong public health care system for Texans.
I do suppose that makes sense.
Thank you.
Yeah, thank you. So as you saw there, when Lauren and I go to different offices across in the Capitol, we do hear some familiar themes that are given to us by certain lawmakers, and it's important to be able to identify those themes and to stay grounded and say, you are right, there are some challenges, but this Medicaid expansion and the Medicaid program is an opportunity that we can't let up right now. We can't not accept so much federal dollars to expand Medicaid to another 1.5 million people.
The other thing we wanted to highlight in that scenario is if you get asked a question or a number that you don't know, it is completely fine to say, I'd love to follow up with you with that information. You all will also have leave behinds that have a lot of the specific numbers about the budget, about how many people would be covered, and you can hand that over. Those are both acceptable ways to just give the information without having to have all of that memorized or anything like that.
And as former staffers, Lauren and I have been used to to have people come into our offices and present information. And it gives us a great opportunity to reconnect with those people who visited when they say, we'll get back with you with those numbers. And then once we hear back, we have a lasting communication line between that individual and our office, and it's very helpful. So lastly, we're going to go on to an opposition lawmaker. Specifically when you happen to be a constituent in that lawmaker's office. And we're going to lay out a couple scenarios. And all right, let's just kick it off.
Senator Travis, I'm so glad to have caught you. I'm Lauren Dimitry with Texans Care for Children.
Well, it's nice to meet you. How are you doing?
I'm great. I'm up from Flower Mound. You know, my kids just started at Flower Mound High School.
Oh, Flower Mound High School. I used to go there. Is Miss Brenham still there?
She sure is. But you know, I know you have such limited time. I'd really like to just, take a couple minutes to talk about this important issue of Medicaid expansion.
Yeah, I have a few minutes before I have to run. Yeah, let's sit down. What do you got?
Great. You know, Medicaid has been really important. I wanted to let you know that Medicaid has been really important to me and a lot of other folks in your community. And you know, actually, it has allowed me to provide, as someone who works at a job that doesn't have health care insurance, it's allowed me to be able to have my kids to have access to preventive care, and it's worked really well for me and my family.
Well, I'm glad you came in to tell me. I've always been a supporter of Medicaid. I've been around a while and know the benefits of Medicaid, but you know, and I think you've heard of this expansion that is proposed in the Affordable Care Act, but I'm just not sure. I've been hearing a lot from people that our Medicaid program is just broken. It doesn't make any sense anymore. It provides low quality of care, really expensive care, and there's just not enough doctors in the system. Why do we want to further Medicaid when it's broken?
Well, you know, that's part of the reason that I have come here today, is because I've come with people from across the state because we want to communicate that Medicaid does work. It actually worked for me, it worked for my children, and it worked for my family, and we think that low-income Texas adults also would benefit from the program.
I definitely hear you. I mean, I appreciate you coming in today. It's going to really take a lot of discussions on our part to figure out what the best solution is for Medicaid, or for Texas. I think that we need the flexibility to provide a Texas solution so that your Medicaid matters. What do you have to say when it comes to the flexibility?
Well, you know, I think that, of course, Texas has to have a version of Medicaid that works for Texas, but we think that the best way to do that is really to take advantage of the incredible federal funds that are available and then look for ways to make Texas Medicaid even better than it already is. And I would really just ask you to consider all the options and hope that I can follow up with you and so can folks in my community about how Medicaid works for us.
Well, again, thank you for coming in. Make sure you grab a card on the way out for my staffer, who will definitely love to get some information from you. And I do have to run, but thank you very much.
Thank you, Senator Travis.
Thank you. So Lauren and I tried. That was my best lawmaker impression. I don't know how I did there. But we do have to wrap it up pretty quickly, but we do want to reemphasize the 3 points, the hook, line, and the sinker. Introduce who you are. Let them know if you're a constituent or not, or if you're a beneficiary of the Medicaid program. Tell your story. Why does Medicaid matter to you? Outline the facts. Why is Medicaid expansion good? And then don't forget your ask. The ask is the most important part. Will you support Medicaid? Will you support Medicaid expansion? And follow up with them. If they want to hear back from you with additional information, get back to them, or also reach out to many of your organizations that have the additional information to help you tell your case to the government, to your lawmaker.
Okay, great. Thank you guys so much. We're going to hand it back over to Laura. She's going to go over some of the materials you have and also some of the logistics. So thank you guys so much and good luck.